You know, spring break is something that we're going to have to do at home. You know, I hope, and given where we are with our immunization program, with transmission, with all of us continuing to do our bit, by the time we get to spring break, we'll be able to safely travel within BC. And we need to think about that within BC, going to our ski hills and going to our campsites and other places. But these things will become clearer as we get towards later on in the month and into March. We will be actively discouraging people from other provinces coming to British Columbia. We are very supportive of the international border measures that have been put in place. I think that's fabulous. It's going to protect us in this very critical few months where we don't yet have enough people protected from this virus. And we have the concern about importation of different strains. So the fewer transmission events that we have in the world, but also in Canada and in BC, the less chance there is for the virus to mutate. So all of the things that we do to stop transmission are important for us individually, but also collectively. And, you know, I made reference to that a little bit because we don't realize maybe how much the little things that we do make a difference. When we see the virus take off and cases take off, it means that the virus is replicating more often, more frequently. It means even if it mutates slowly, those mutations can start to build and grow. So travel restrictions are one of those measures that helps us keep out new strains that could disrupt our ability here, but we all need to still do our own measures. So absolutely, you should not be thinking about international travel for vacations, for leisure in the next few months. If we can get this under control and get people protected, you know, we can have a summer again. Let's think about that. Let's think about how we can get there. We can get there safely and not have more of our family members, our community, be affected by this virus.
Follow-up, Binder?
Yes, and you said there that you would be looking at measures to actively discourage people from other provinces from coming to BC. Are you looking at implementing some sort of restrictions there? And can you just clarify again, just on local ski hills, if you're in Vancouver, can you go to Whistler? If you're on Vancouver Island, can you go to Mount Washington? Thanks.
Yeah, you know, all of these details are things that we are still in discussions with. I would say, you know, day trips are less risky with your family, your household. If you're somebody who works or has strong connections and lives partly in Whistler, then yes, that is your local ski hill. Day trips to Mount Washington. It's, as we said, it's not the skiing itself that seems to be the risk. It's the things that we're doing before and after, and particularly if we are staying over, having people over, and that is what we're seeing in a number of places around the province.
I just want to say, in the summer, there were a number of cases in interior health around Kelowna. And at the time, Dr. Henry and medical health officers responded with rules about temporary rentals. And those rules apply. They apply to those renting properties, and they apply to those who rent out the properties. So those obligations are on both sides. With respect to rentals, for example, condo rentals and parties in condos and so on, there are strict limits, even when such activity takes place, and those limits apply in those cases. They prove to be effective in Kelowna, where we turned back to read the rise in cases there in the summer. People listened, they followed the rules, and things got better. And that is our expectation everywhere.